Gun violence against children is in the spotlight this week after the shooting in Odessa, Texas. One of the victims was a 17-month-old child, another a high school student who unfortunately passed away. Firearms are the second leading cause of death for kids in the U.S. Alexa Liautaud talks with a researcher who's looking into this growing public health issue.
Considering Odessa, considering the recent shootings that we've seen, walk me through what you guys found in terms of the prevalence of firearm deaths in America for young children.
Sure. So for children and teens, the leading cause of death is motor vehicle crash. The second leading cause of death is firearm injury.
Is there a breakdown between what types of firearm shootings are impacting these children and teens?
60% of children and teens die by firearm by homicide, and about 40% die by suicide. Accidental or unintentional injury is also a 3 or 4%. For the mass shootings that we're seeing, those horrific shootings represent less than 2% of the way that children and teens die by firearms in the country.
Have the numbers changed significantly in recent years?
We used to have 10 kids per 100,000 dying in cars in our country. We now have 5 over the last 20 years. In that same time period, firearm injury death, we made almost no change at all in it over that entire period. That rate is about 4 per 100,000. From 2013 to 2017, we see a rate of increase about 32% for homicide and about 26% for suicide by gun. So firearm injury death is increasing.
What does your data tell us about where America is putting its prevention efforts?
It tells me that we're not trying. Research in this area has been almost stagnant completely, with increasing efforts over the past several years in very small amounts. But there's been virtually no federally funding for research over my entire career.
How do you explain that?
So it's been too political. In the late 1990s, with the Dickey Amendment, there was really a stagnation entirely of federal funding in this area. And because of that, the field almost completely went away.
How big is your field right now?
In 2017, we had a team of about 20 people. Several years later now, there's likely 100, perhaps 200 scientists across the country. So to give you some balance on that, every university in the country has a major cancer institute with hundreds of scientists focusing on cancer research. The way that we need to work on this differently is to stop viewing this as an all or nothing issue around the politics of having or not having guns, and understand that in the same way that we have cars, we are going to have guns, and yet with that, we can still have us be a lot safer.
How does the U.S. compare to other countries in the world when it comes to the prevalence of mass shootings?
You know, 90% of all the firearm deaths for kids happen in the U.S. The kids in our country in middle school and high school, the thing that they're most likely to die from in our country before they finish those adolescent years is firearms. And I think we can do better than that. People ask me sometimes, what is the one thing we should do to decrease these deaths? It is like asking, what is the one thing we should do to decrease cancer? What is the one thing we should do to decrease drownings? There's an entire multitude of angles that we need to approach this at, and that can be done by building the field of science and inquiry around it.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.